long after taxes and fees levied by the bill would have begun. Even with that change, there's plenty in the CBO report to suggest that the promised budget savings may not materialize. If you read deep enough, you'll find that under the Senate bill, quote, federal outlays for health care would increase during the 2010-2019 period, not decline. The gross increase would be almost $1 trillion, $848 billion to be exact, mainly to subsidize the uninsured. The net increase would be $160 billion. But this depends on two big gambles. Will future Congresses actually impose the $420 billion in cuts to Medicare, Medicaid, and other federal programs? They never have. So why don't we tell the truth to the American people and take these supposed cuts out of this bill? And tell them the truth about what it costs. And tell them the truth that this is a dramatic expansion of entitlements, but at the same time, those presently eligible, those senior citizens who are in the 330,000 that are under the Medicare Advantage program in my home state of Arizona, will not see that program maintained. You cannot reach these kinds of savings, these kinds of reductions, these kinds of cuts without impacting existing programs, and I know of no expert who says that it will, that is an objective observer. And I believe that Dr. Coburn, Dr. Barrasso, and others in the medical profession will say the same thing. Every time that Congress has enacted so-called cuts in Medicare or contemplated it, they have never taken place. The doctor fix, well, we took care of that problem, we just took it out of the bill. But you know what we're going to do about the doctor fix? Every year we're going to delay it and delay it and delay it every year, and it'll never happen. That's been the history of the so-called doctor fix since its beginning. And will this Congress enact the excise tax on high premium insurance policies, the so-called Cadillac plans in Reed's bill? Obama has never endorsed them, and House Democrats, reacting to union pressure, turned them down in favor of a surtax on millionaires' income. The challenge to Congress and to Obama remains the same. Make the promised savings real and don't pass along unfunded programs to our children and our grandchildren. That means taking this legislation back, taking out these cuts in Medicare and programs that are vital to our citizens of this country, and come back with a realistic piece of legislation that has malpractice reform, ability to go across state lines to get the health insurance policy of your choice, rewards for wellness and fitness, expansion of health savings account, medical malpractice reform. There's many cost-saving measures that we can enact to bring the costs of health care in America under control and preserve the quality. Instead, we are doing just the opposite. If you're going to make these kinds of cuts, the $420 billion in cuts to Medicare, Medicaid, and other federal health programs, then you are going to impact the provision of health care in America. Now, Americans have been clear that overspending has to stop. Nor do the American people believe that empowering Washington bureaucrats in a new federal health care entitlement is health reform. The other side disregards the message from the American people all across the country, and the bill just does the opposite. I want to talk just for a minute about a provision in this bill that's very important, and that is the transfer of power, the massive transfer of power in this bill to the Secretary of Health and Human Services. This is a huge transfer. HHS would become federal giant under Senate plan by Susan Ferricchio. A quick search of the Senate health bill will bring up, quote, secretary 2,500 times. That's because Health and Human Services Secretary Kathleen Sebelius would be awarded unprecedented new powers under the proposal, including the authority to decide what medical care should be covered by insurers, as well as the terms and conditions of coverage and who should receive it. I want to repeat that. In this bill, the Secretary has the authority to decide what medical care should be covered by insurers, as well as the terms and conditions of coverage and who should receive it. Now, we saw a little precursor of that just the other day with the recommendations concerning mammograms. A board recommended that women under 50 should not get routine mammograms. Well, of course, the response was incredible and justified by women all over America who are now alive today because they had mammograms prior to the age of 50. And the Secretary of Health and Human Services said that that wouldn't be carried out, etc. Well, we are creating a situation where the Secretary of Health and Human Services and a board would decide that. The legislation lists 1,697 times where the Secretary of Health and Human Services is given the authority to create, determine, or define things in the bill, said Devin Herrick, a healthcare expert at the National Center for Policy Analysis. For example, on page 122 of this 2,079-page bill, the Secretary is given the power to establish, quote, the basic per enrollee per month cost determined on average actuarial basis for including coverage under a qualified health care plan. The HHS Secretary would also have the power to decide where abortion is allowed under a government-run plan, which has drawn opposition, obviously. And the bill even empowers the department to establish a Center for Medicare and Medicaid Innovation that would have the authority to make cost-saving cuts without having to get the approval of Congress first. Quote, it's a huge amount of power being shifted to HHS, and much of it is highly discretionary, said Edmund Halsmeyer, an expert in healthcare policy and insurance markets at the Heritage Foundation, a conservative think tank. Halsmeyer said one of the greatest powers HHS would gain from the bill is the authority to regulate insurance. States currently hold this power, and under the Senate bill, the federal government would usurp it from them. This could lead to the federal government putting restrictions and changes in place that destabilize the private insurance market by forcing companies to lower premiums and other charges, he said. Quote, Health and Human Services doesn't have any experience with this, Halsmeyer said. I'm looking at the potential for this whole thing to just blow up on people because they have no idea what they're doing. Who in the federal government regulates insurance today? Nobody. The healthcare reform legislation would rely on the U.S. Preventative Services Task Force for recommendations as to what kind of screening and preventive care should be covered. Last week, the group, which operates under HHS, as I mentioned, drew sharp criticism for advising that mammograms should begin at age 50, a decade later than the current standard. Critics of the bill said this was an example of how the new bill would empower HHS to alter health care delivery. But Democrats argue they would rather have the government making these decisions. That's the key to it. They would rather have the government making these decisions. If you like the way the post office is run, you will love the way HHS runs health care in America. I understand the other side's amendment may to address some of this, but under the Reid bill that the Senate moved to consider beginning in 32 days, the language from the bill on page 1189 authorizes the Secretary to modify benefits under Medicare pursuant to task force recommendations. As I mentioned, how many women would have died if the coverage provision guiding the new federal plan under mammograms had been implemented? And then on the following page, 1190, the Secretary is authorized to deny payment for prevention services that the task force recommends against. So, if this unelected panel changes the preventative recommendation for some other type of cancer, the federal government plan won't cover it. I don't think the American people want their health coverage decisions coming from a panel in Washington. The Reid bill drives up costs and premiums. Just today, the CBO released its assessment of what will happen to health insurance premiums under the new entitlement compared with premiums today. The CBO dealt a blow to claims that the health care bill introduced by Senator Reid will lower premiums when they released an analysis showing that premiums will go up significantly in the individual market. Premiums for individuals without employer-sponsored coverage would increase 10 to 13%, or $2,100 per family, in 2016. The Democrats' bill, therefore, requires individuals to purchase insurance that's more expensive than would be available under current law. For small businesses and employers, the bill largely preserves the status quo and does little, if anything, to lower their costs. In fact, CBO estimates that under the Reid bill, the average family with employer-sponsored coverage will soon pay more than $20,000 per year for health insurance. President Obama said during the campaign, he said, quote, "I have made a solemn pledge that I will sign a universal health care bill into law by the end of my first term as president that will cover every American and cut the cost of a typical family's premium by up to $2,500 a year." Well, CBO's analysis shows that the president is breaking that pledge by both failing to achieve universal coverage and raising premiums, just as it contradicts an analysis by MIT economist John Gruber, released by the White House this weekend, claiming that individual premiums would go down. In fact, even with the generous assumptions made by CBO, in a number of areas, premiums will either go up or remain unchanged. From the CBO report just today, CBO says that premiums in the individual market would be 10% to 13% higher in 2016 under the current law. Average premiums would increase by $300 for an individual policy and by $2,100 for a family policy. The new benefit and coverage mandates actually drives up premiums by 27 to 30%, and this increase is offset by other factors like new administrative efficiencies. CBO says a little more than half of enrollees in the individual market would receive a government subsidy. However, the bill before us will still require nearly 14 million Americans to purchase unsubsidized insurance that is more expensive than the one they have today. President Obama has promised that seniors will not see a reduction in benefits. In fact, he said recently, people currently signed up for Medicare Advantage are going to have Medicare and the same level of benefits. How do you get there? How do you get there when you're cutting Medicare Advantage by $120 billion? There is no math, old or new, that gets you to no change in the benefits that they have under Medicare Advantage and yet cut $120 billion. Traditional Medicare doesn't offer coordinated benefits that can improve the quality of care, and traditional Medicare doesn't have many of the aids that benefits our seniors. President Obama has also promised several times, if you like what you have, you can keep it. The American people took those words as a promise, and that if they had a health benefit that they were happy with, they could keep it. I want to make sure we're helping the president keep his promise. I want to help him keep his promise by sending this bill back, taking out the cuts that are in it on Medicare, on the $105 billion cuts in the hospital, nursing homes, $14.6 billion, hospice, $7.6 billion, Medicare Advantage, $120 billion. Send it back to the Finance Committee and come back with a bill that the American people can believe in, that will preserve the solemn obligations we've made to our senior citizens. Medicare Advantage provides the only choice in the Medicare program, allowing an option for seniors who want additional benefits or a better option. Medicare Advantage is working for nearly 11 million seniors to give them a choice about their health care and better benefits. As I mentioned, 330,000 beneficiaries in my state of Arizona are in Medicare Advantage, and they would see benefit reductions or their plan disappear. 89% of seniors need and have some form of supplemental coverage on top of Medicare to provide protection against out-of-pocket costs or additional benefits. Many low-income Americans and minorities rely on Medicare Advantage as their supplemental coverage. Some have claimed that cutting the, quote, extra payments to Medicare Advantage plans reduces insurance company profits. Under federal law, that's simply not the case. The fact is, 75% of those extra payments go directly to better benefits for seniors under current law. The other 25% goes back to the federal government. Unfortunately, those extra benefits will be taken from seniors who are enrolled in Medicare Advantage. The bill contains $120 billion in direct cuts to private Medicare plans. Common sense says you can't do that without affecting benefits. The Congressional Budget Office thinks so as well. CBO assumes that the Breed bill will cut benefits by more than half, from an average of $98 in additional benefits to $41 a month. So I see that one of my colleagues is waiting to speak. So I hope that the American people will understand what we're trying to do here. All we're trying to do is send this back to be reworked, to be fixed on a bipartisan basis, not to force $400-some billion in cuts and benefits that we have promised the American people. Send it back. Come out with a bipartisan approach. Sit down for the first time with Republicans and Democrats. Have the C-SPAN cameras in the way that the president promised that he would back last October, a year ago. And let's sit down together and figure out how we can fix this. And the best way to fix it is to preserve the quality of health care in America and bring down the cost, not to pass a 2,074-page monstrosity that is full of the measures that would impair the ability, particularly of our senior citizens, to keep the benefits that they have earned and we have promised them. Madam President, I yield the floor.